Hello, and thank you for tuning into this video on communication with individuals with dementia. So first off, a little background on who I am. So I'm a graduate occupational therapy student at the University of Findlay. I am recording this in April of 2025, so if you are watching this after that, I will most likely be graduated. But this is part of my capstone project, the last step of my education, and part of my project is I implemented this session a couple times in person, and I'm now recording it for my capstone site, The Manor at Greendale, to upload this on their YouTube channel for people to use in the future. So I have a special interest in dementia care. My grandfather had dementia the last stage of his life, and something that was really difficult for my family was communication was a big adjustment and change for us. And so that's kind of what inspired the project and wanting to look into how we can improve how we communicate with individuals with dementia. So I've dove into the research and put together this presentation. So the outline of what we have for this presentation is I'll give you guys a brief overview of dementia as a process, kind of what the disease looks like, and then we'll go into how dementia typically impacts communication and the importance of communication in general. And then we'll go over some things, what you can do before engaging in communication to make communication more successful, kind of like setting up the environment to be as successful as possible. Then we'll dive into some general communication tips, and then the importance of nonverbal communication and other factors that affect communication and how to deal with these, things like hallucinations and delusions. And then I will look over some hypothetical scenarios for you guys to kind of apply some things based on what you learned. So first off, the overview of dementia. Um, Kind of a misconception sometimes, but dementia is not a specific disease. Rather, it's a term for a set of symptoms caused by different disorders affecting the brain. So these symptoms are severe enough to impair daily life and independent functioning, and these symptoms are progressive, leading to the individual to needing more help and support. So there's many diseases that can cause dementia, including Alzheimer's disease, which is kind of used interchangeably with dementia sometimes, but it is just one of the many diseases that can cause dementia. There's also vascular dementia, Lewy body disease, frontotemporal dementia, and Creutzfeldt-Jakob disease. Common symptoms of these include memory loss, difficulty thinking, difficulty problem solving, difficulty with language, and changes in mood and behavior. So in the initial stage of dementia, there's only a small part of the brain that's damaged. And each type of dementia affects a different area of the brain initially. So this is why you'll see at the beginning symptoms kind of vary between the different types of dementia. For example, in Alzheimer's, early Alzheimer's, memory loss is very common, but in early frontotemporal dementia, memory loss actually isn't as common. However, as dementia progresses, the symptoms of the different dementia types become more similar due to the disease affecting more and more areas of the brain as it progresses. And so you'll have, as it progresses, additional symptoms show up due to more of the brain being affected, and then already damaged areas of the brain become even more affected, causing symptoms the individual already had to experience to get worse. So we'll talk briefly here about the stages of dementia, and we'll dive a little deeper into each stage. But there are three stages typically: early, middle, and late stage, also referred to as mild, moderate, and severe. These stages serve as a guide for the process, but there's not really an exact set of steps or like set guidelines on like when somebody crosses into another stage out of another. So that can make it really difficult to tell when a person has progressed to the next stage. A lot of times they overlap. People may experience symptoms in a different order than you would typically expect, or they may not experience certain symptoms at all. Um, they may start experiencing a symptom that's typical for late stage, but they're still technically in middle stage. But it kind of can help to just kind of view these stages as like a guideline, not necessarily hard stages necessarily. So, and it's natural to want to know what stage the individual's at and what may come next, and those are good things to know. But it's also important to focus on the person in the present moment, focus on what they need currently, and while still being aware of what's coming next. So, the early stage, a lot of times the first signs of dementia are hard to notice, and they're easy to kind of write off to something else. Um, just kind of not really think of it as a symptom of dementia. But people in this stage, they often stay largely independent. They may need a bit of assistance with daily living, but they're largely independent in this stage usually. Memory problems are the most commonly known first symptom, as we know, and often the first and main symptom of Alzheimer's disease. You'll also usually see memory problems early in vascular and Lewy body dementias. Other symptoms that you may see in the early stage, um, language and communication difficulties, poor orientation, so not knowing maybe where they are, what day it is, those kinds of things, not knowing the time of day, visual perceptual difficulties, so just problems with that vision and interpreting what they're seeing, and then changes in mood and emotion as well. So getting into the middle stage, symptoms become more noticeable in this stage, and the individual needs more support in their everyday life. Um, Changes in behavior typically start in this stage, and behavior changes are some of the most challenging symptoms to deal with. They can start in the early stage, but you typically see them in the middle to late stage. But common behavior changes include agitation, restlessness, screaming or shouting, repetitive behaviors such as asking the same question over and over, following a carer around, sometimes referred to as trailing, disturbed sleep patterns, losing inhibitions, so saying inappropriate things, maybe undressing in public. Sometimes they may become more agitated in the late afternoon or early evening, which is known as sundowning. That's often due to having a physical or emotional need that's not being met, for example, hunger or boredom. This stage is often the longest. You'll see in this stage, existing problems with their memory and thinking will worsen. The way a person speaks and uses language likely will get worse in this stage. Problems with orientation likely will become more severe. Um, Symptoms of apathy, depression, and anxiety, those can show up or they can continue if it was a problem for the person in the early or before this diagnosis. And then delusions and hallucinations may start to show up in this stage as well, which is something we will talk more about later. So getting into the late stage, this is typically the shortest stage. And in this stage, the condition will have a severe impact on most aspects of the person's life. They will likely eventually need full-time care and support with daily living and personal care. And then symptoms of all kinds are likely present, and symptoms of all types of dementia look more similar in this stage than in other stages, just because of the majority of the brain being affected at this stage. Altered perception and physical problems are often the most noticeable symptoms in this stage to differentiate it from others. So, common physical problems seen include walking slower, um, increased risk of falls, needing a lot of help with eating and therefore losing weight, maybe difficulty swallowing, and then incontinence. Other typical symptoms that will be seen or worsen at this stage, excuse me, are memory problems, language difficulties, changes in moods, emotions, and perceptions, and changes in behavior. Something else that can typically happen, or if it does happen, it typically happens in this stage with their memory, is called something called time shifting, meaning they may think they're at an earlier period of their life. Um, I saw this with my grandpa where he woke up from a nap one time and was asking my grandma how he did in the basketball game, asking about, his high school team and his high school coach, and asking how he played and all this. And um, so he just kind of thought he was at this early period of his life. So that's something called time shifting and can be seen in this late stage as well. But often they forget familiar people or may not even recognize themselves in the mirror at this stage as well. Um, depression, depression and apathy are particularly common as well, and delusions and hallucinations are most common in this stage. They can be seen other stages, but most common in this stage. Something else that can become common in the late stage as well is aggression. Um, and this is typically in response, a lot of times in response to help with personal care. They may try to hit, push away, or shout. Often they just feel threatened, scared, or confused. And restlessness also becomes common, and it can appear they're searching for someone or something at this stage as well. So, getting into communication specifically, why is maintaining communication important? Well, proper communication helps people with dementia keep a sense of self. Really communicating with people um, helps. It's a big part of who we are as people. Helps them to sustain relationships. I mean, you think about um, people you lose touch with. A lot of times over time, that relationship almost goes away. So maintaining those communication with those people helps maintain those relationships, and then maintaining a good quality of life. You think about what your day would be like if you didn't communicate with anyone. Um, Probably would be not the best quality of life after a little while. So making sure we're communicating with people is a big part on maintaining a good quality of life. So let's go over some typical changes in communication for someone with dementia. Something to keep in mind here, though, is that each person's unique, and dementia is going to affect everybody slightly differently. Um, there are many causes. There are many causes of dementia that affect the brain differently. There are several common ways that dementia is affected, including all these on your screen: difficulty finding a word, using a related word or a substitute for a word. For example, they might say book instead of newspaper as a related word, or a substitute, they might say thing you sit on instead of chair. Um, Using speech that doesn't make sense, so they might use words that don't have any meaning, or they might be jumbled or they're in the wrong order. Um, they may have an inability to understand what others are saying, or only being able to understand part of what is being said. Um, Losing some writing and reading skills, loss of social conversation norms, such as like knowing when to respond, responding appropriately, proper volume level, those kinds of things. Difficulty in expressing emotions appropriately that can show in that aggression that we talked about earlier. They can revert to their first language learned, like if English is a second language and say Spanish was their first, they can revert to just speaking Spanish and almost pretty much forget how to speak English, which can be a great challenge for some. Uh, Making comments that are inappropriate for the situation. They might repeat themselves or ask the same question repeatedly. They can easily lose a train of thought, and they may speak just less often in general and rely more on gestures and kind of nonverbal communication in general. Okay, so how do those typical changes in communication affect people with dementia? So it leads to an inability to express themselves properly, just not being able to communicate in the way they would like to. A loss of confidence, just not being able to communicate typically leads to that loss of confidence. Feelings of anxiousness or depression, feeling like they might screw something up, um, becoming withdrawn and becoming easily frustrated, and exhibiting behaviors that are challenging and or difficult to understand as well. So let's talk specifically about following conversation quickly. Due to changes in the way individuals think with a dementia diagnosis can also make following conversations more difficult, which further complicates communication. So it can become more difficult due to not understanding what was said, not being able to stay focused, thinking more slowly, or unable to put correct words together to reply. So they may take longer to process thoughts and work out how to respond to what is being said. They may also move from one topic to another without finishing a sentence, as it becomes harder for them to focus as well. So these are just some changes and difficulties that can occur with following conversation specifically. Okay, so let's go over some things you can do before starting conversation to make sure communication happens as effectively as possible. So, starting with making sure the individual is comfortable. Um, so, ensuring you're in a good place to communicate. Ideally, this will be a quiet and calm place with good lighting. Busier environments make it more difficult to concentrate and focus on the conversation. Going along with this, making sure distractions are turned off or at least turned down, such as like the TV or the radio. Really, anything making background noise can provide a distraction and can be a bigger issue for an individual with dementia than someone without that diagnosis. Um, so, next, trying to communicate during ideal times of the day. So, what this means is some people communicate better during certain times of the day. So, this can take some trial and error to figure out, but you might notice you have more success communicating in the mornings versus the evenings, or vice versa. Um, So just kind of planning out when you're going to visit or interact with the person based on that can be helpful as well. Meeting individuals' other needs, such as making sure they're not in pain or hungry or need to go to the bathroom or any sort of other need like that. Um, of course, we have our body signals that tell us those things. And for someone with dementia who already has more difficulty focusing, like we were talking about, um, that can provide even more of a distraction when you're trying to have a conversation with the person. So, trying to make sure those needs are met just so there's no other stimulus that they are having to pay attention to in addition to your conversation. So, some additional things here: preparing to communicate, plan enough time to spend with the person. If you're trying to rush through and you might have somewhere else to be, that can lead to you becoming short with the person, and then that can be lead to some more difficulties as well. Making sure to get the person's full attention before you start communication. That way you know that their attention's on you, they're listening to you, that they're not paying attention to something else in the room. And then thinking about what you're going to talk about. A lot of the times you'll have something specifically you are going to talk to them about. But if you're just going to spend time with the person, it helps to have certain conversation topics ready before beginning conversation. And if you aren't sure what to talk about, you can use the environment to help. Anything they can see, hear, or touch might be of interest. So let's talk about tips specifically for listening to an individual with dementia. When I say communication, typically we think about how we'll speak to them, but listening is a big part of it as well. So, of course, the first couple we hear, listen carefully and maintaining eye contact, are good communication tips for anyone, but even more so for someone with dementia. Um, Stop what you're doing to be able to give them your full attention. Um, Individuals with dementia, I mentioned earlier, they rely a lot more on nonverbal communication. And so if they see that they don't have your full attention, they might become frustrated or discouraged. So whatever you're doing, just try and stop, be able to give them your full attention. Maybe you have to send a text real quick and you just let them know. Send it real quick, put the phone down, and give them your full attention. Offering encouragement both verbally and non-verbally. Non-verbally can be just a gentle hand on the person if appropriate. Um, but there is that loss of confidence and sometimes anxiousness when it comes to communication for people with dementia. And just providing some of that reassurance can be all the person needs sometimes. So pay attention to their body language and facial expressions, especially if they're having trouble communicating what they're trying to communicate. Sometimes that can give you a good idea of what they're trying to say. You can ask the individual to repeat something if you're unsure what they're saying, and if it's still unclear, just ask them to rephrase it slightly, or excuse me, rephrase their answer, saying it back to them slightly just to check your understanding. If they're having difficulty finding a word or finishing a sentence, ask if they can explain it in a different way. If they can't find the word for a particular object, ask them to describe the object instead of coming up with a specific word for it. So talking specifically on just allowing the person to express themselves, allowing the person plenty of time to respond. So it may take the person longer to process the information you said and formulate their response. So just allowing them plenty of time to process and come up with their response before you jump back in. Also trying not to interrupt the person, even to help them find a word. The reason for this is it can break the normal pattern of communication, which becomes even more important for someone with dementia. So allowing them to work through it and struggle with it for some time before jumping in to help. Just trying to let them come up with it on their own. You may have to jump in at some point, but trying not to interrupt the person, trying to let them come up with it on their own. And if the person's upset, give them time and opportunity to express their feelings. Sometimes the best thing you can do for the person is to just be there and listen to whatever they have to say. And try not to dismiss their worries, even if it's something you know is untrue or you don't feel is a big deal. Just acknowledge what they're expressing and validating those feelings for them. So here we'll get into some general communication tips for talking with an individual with dementia. So speaking clearly and calmly is a good practice for any sort of communication, but for someone with dementia, even more so, just to ensure they're hearing you properly. Using short, simple sentences. Um, Sometimes those longer sentences they're not able to focus on, or it's too much information to process. So using those just shorter, simple sentences as much as possible. Avoid talking down to the person. A lot of times we kind of do that by default, but trying to just remind yourself, they're another adult, they're another human just like you, to try and avoid talking down to the person. Including the person in conversations with other people, um, especially if the conversation's about them. Um, so like maybe there's another doctor in the room and you're talking about the person. Just trying not to talk like the person is not in the room, talking like they're not there, and including them in questions about their care. Uh, they're not always going to be able to give you the best, most accurate answer, but still including them in the conversation um, does a lot for their confidence and self-esteem in that. So you may ask them, and then you can default to the doctor as well. And it doesn't just go for conversations with doctors, really. If anyone's in the room, just making sure they feel included in the conversation. And avoid speaking harshly or raising your voice. Sometimes it's easy to do when we get frustrated, but a lot of times they won't understand why you're speaking harshly, why you're raising your voice to them. And this can lead to them becoming upset and confused, not understanding why. Allowing time for the person to process and understand what was said, we mentioned with allowing the person to express themselves. Using specific names or labels when appropriate. So instead of, like, if they have, say, a son named Jim, instead of just saying Jim, saying your son Jim, assigning that label, because sometimes they won't always remember exactly who it is. And the same with labels. So maybe there's a lamp in the room and you might say like the lamp over to your right, just so they know exactly what you're talking about. You may have to go at a slightly slower pace, but try to keep a regular conversation pattern. As I mentioned, that conversation pattern becomes even more important for people with dementia. So you may have to slow it down a little bit, but don't over exaggerate speaking slowly. And then don't bring attention to the memory loss as well. Um, so pointing out that they might have forgot something that can be upsetting for the person, um, leading to that lack of confidence and things like that. So even if they have forgotten something, just try not to bring attention to it as well. Getting into a few more tips here, try to avoid asking too many questions or asking complicated questions and trying to stick to one idea at a time, just trying not to jump from topic to topic, trying to stay on one topic as much as possible, phrasing questions in a way that allows for simple answers. For example, not asking what they want for dinner, instead asking what would you like for dinner, beef or chicken, giving them a couple options. If you can phrase questions in a yes or no format, those are really helpful as well. If they're having a difficult time understanding what you're saying, even after you've repeated it, try to say it in a slightly different way. Sometimes it's just one or two words that is the problem for them, and so just rephrasing it slightly can be all it takes sometimes. Um, Another thing is to not argue with the person. Sometimes, especially with things like delusions and hallucinations, it's easy to want to argue when they're not true, but those beliefs are firmly rooted in the person. We'll talk about that later too, but not really going to change that belief, so arguing with the person is just generally not productive. If the person's upset, try and redirect to a different topic or a task. Maybe if there's a certain topic they like talking about, like their family or sports or things like that, you can redirect to that. Maybe they really like puzzles or simple card games, and you can direct to that as well. Just kind of providing that distraction. Prompts can help, so pointing, having them hold an object that you're talking about as well. Like I kind of talked about with the lamp, pointing to the lamp to their right, that can help them to understand exactly what you're talking about. Acknowledging what they said, even if they don't answer the question or they say something out of context. So you might ask a question, they may not answer it, or say, like I said, say something out of context. Acknowledging what they said before you jump back to your question helps them to feel more included in the conversation still. And encouraging laughter over misunderstandings, ensuring you're not laughing at the person. So a lot of times it's just if there's a misunderstanding, I find it easy to just blame yourself. So just blaming yourself and encouraging laughing over that can help the person feel more relaxed. And then being patient with the person and with yourself. It's a big change, not just for the person, but for you as well. And with that in mind, it's important to have that patience as you work towards improving this. So just making sure to be patient, like I said, with the person and with yourself. We'll get into a little more of the nonverbals now, starting with body language. So first is standing or sitting where the person can see and hear you as clearly as possible, and trying to be at eye level with them. A lot of times, like if they're sitting and you're standing and you're looking down on them, that can be kind of an intimidating position for the person. So just trying to be at eye level with them. Being as close to the person as is comfortable for the both of you. That way they're seeing and hearing you as clearly as possible, but you don't want to crowd them too much to where they feel uncomfortable. And then making sure your body language is open and relaxed. An example of this is not crossing your arms too much. We've had studies show that crossing your arms communicates nonverbally that you're kind of closed off to what the person is saying and not really listening. So having those arms open, facing the person, making eye contact with them are good ways to show that you are listening. So talking more about nonverbal communication specifically, what it is, communicating without the use of spoken words, appropriately named, but it includes our gestures, our facial expressions, and our body language. And here is why nonverbal communication is so important. Nonverbals account for 55% of our communication. The tone and pitch of our voice account for 38% of the communication, and the words used only account for 7% of our communication. So our nonverbal communication really makes up the majority of how we communicate. That's how most of the message is communicated, and so it becomes very important. And it becomes even more important as dementia progresses and communication becomes more difficult. So, how do you use nonverbal communication? Using physical contact when appropriate, holding their hand gently, placing a gentle hand on the person. Try to avoid sudden movements and tense facial expressions. Someone with dementia may see this, read into that, and become a little distressed, upset, things like that. And making sure your facial expression and your body language match what you're saying, even if it feels forced. So if you're talking about something happy, something good that happened, making sure you have a smile on your face. Again, even if that feels forced, it helps the person with dementia see that what you're talking about is a good thing, a happy thing. It helps them to understand the message you're communicating even more. So try to pay attention to the individual's body language as well. This can help you to understand what they're communicating. So facial expressions are a big one to help understand what they are communicating. So what are some other factors that affect communication? So some big ones here: hearing loss, sight loss, pain and discomfort, illness, and medication side effects, and delusions and hallucinations as well are all factors that can affect communication. And we'll talk a little more in depth on some of these, starting with hearing loss. So, hearing loss, most people over age 70 will have some amount of hearing loss. Not being able to hear what's going on around them or what other people are saying can add to confusion and frustration that may already be there with communication. And both hearing loss and dementia individually can result in feelings of social isolation, which makes communication with someone who experiences both even more important. So what can you do for hearing loss? Well, if they have a hearing aid, of course, ensuring that it's fitted properly and it's working correctly. Ensure you're facing the person and your face is well lit so the person can see your lips. A lot of times, someone with hearing loss will rely on those lip movements if they're not able to hear as well to really understand the words you're saying. And then not shouting or over exaggerating your lip movements. A lot of times, if someone's hard of hearing, we almost want to talk in slow motion, which can actually make it even more difficult because, like I said, they use those lip movements and they're used to your normal lip movements. So you may have to raise your voice, of course, but just try and not making sure you're not shouting at the person and speaking clearly and slightly slower. But again, trying to keep that normal conversation rhythm. We don't want to talk in slow motion, but you may have to slow it down a little bit and making sure your words are very clear. And don't cover your mouth when speaking. It seems like that goes without saying, but maybe you have a phone up in front of your face while you're talking and it's covering your mouth. You may just unconsciously be covering your mouth at certain times. So just making sure to keep your mouth uncovered. So we'll talk about sight loss now. Of course, many people have sight loss as they get older as well. They're likely to experience more difficulties due to their dementia. Not being able to see what's around them can lead to increased disorientation, worse mobility, and a higher risk of falls. And again, with same as hearing loss, dementia and sight loss individually can lead to feelings of isolation, so it makes communication even more important. And communicating with an individual with dementia and sight loss can be more difficult due to the individual having more difficulty picking up on nonverbal cues or following a conversation as easily. So, what can you do for an individual with sight loss? Well, if the person has glasses, ensure they're wearing them and they're fitted properly, of course. Um, Before starting communication, you can introduce yourself or get the person's attention in another way before starting and ending conversations. That way, they know who's talking to them and that someone is talking to them and where they're at. If you're helping the person with a task, tell them what you're doing before starting and during the task. We kind of mentioned with helping someone with personal care, that's where aggression can come out sometimes. So just communicating what you're doing, like I said, both before and during the task can help decrease the odds of that. Um, using reference points when describing items in the room, like I mentioned with the lamp earlier, you might say the lamp over to your right and point to it, and that will help the person understand what you're talking about. And then ensuring the physical environment is not making communication more difficult. So background noise like the TV and radio, like we mentioned. But for someone specifically with sight loss, making sure there's adequate lighting and things like that. So just making sure the environment is ideal for communication. Now we'll talk about hallucinations and delusions. So these can be symptoms of dementia. So delusions are false beliefs that will not change even if evidence is given against the belief. So they're firmly rooted within the person, and they can show up in paranoid beliefs or accusing others of things that haven't happened. So a lot of suspicion, maybe accusing someone of stealing from them, those kinds of things. So hallucinations are incorrect perceptions of objects or events involving the senses. So they seem real to the person, but can't be verified by others, and they can result in positive or negative experiences. And they can involve any of the senses, but most commonly they are auditory or visual. But you can have hallucinations with other senses, such as taste and smell. They may taste or smell something that's really not there. So possible causes of these changes in the sensory system, so hearing and vision loss, can be a cause of hallucinations and delusions. Medications or illnesses such as UTIs, unfamiliar environment and or people, inadequate lighting can kind of cause some shadows that can cause hallucinations. Disruption in their normal routine and items being moved from their typical spots can cause that one specifically a lot of suspicion and delusions. So what can you do for hallucinations and delusions? So if they're experiencing suspiciousness, look for the items and remind the person where their valuables are stored. Don't refute the suspicion. So don't say it's not true, but just remind them where something might be and help them look for the item. And don't scold the person for losing or hiding items. And if possible, keeping a spare set of frequently lost items like a wallet or keys. And investigating suspicions that could be true. Most of the time, delusions will not be true, but it's always worth looking into if a delusion could be true. Increasing lighting in the room can help decrease hallucinations. And then don't directly disagree with a false idea or argue with the person. As I mentioned, they're firmly rooted in the person, and even when provided evidence against the belief, they won't change the belief. So arguing with the person really won't do anything, unfortunately, and it can be difficult to want to try not to argue. I mean, we want to correct the person, but it really won't be productive in any way. Validating any fear they may be experiencing. So you have to think, if someone's really believing someone is stealing from them, that would be a pretty scary thing. And so really just validating the emotion they're feeling with that without confirming or refuting the suspicion. So just saying something like, oh, I'm really sorry. That must be very frustrating, or that must be really scary. Things like that, where you're not refuting the suspicion, but you're not confirming it either, but still validating the emotion that they're feeling. And some other things you can do here is reviewing medications and scheduling hearing and sight evaluations just to rule out those causes because they are possible causes. So here are some hypothetical scenarios that you can use to apply some of the knowledge we've talked about here. So one scenario here is your loved one's been seeing a doctor every 2 months for the past 2 years. You go to pick them up for this appointment. And they say, what doctor's appointment? There's nothing wrong with me. So what would be an appropriate response to that? I'll give you a couple seconds here. But a good appropriate response to that would be, oh, it's just a regular checkup, nothing to worry about. Not making it a big deal and not bringing any attention to that memory loss as well. So the second one here, you visit your loved one and they find a check that they had written and they say, I did not write this check, the bank must be forging my signature. What would be an appropriate response in this case? A good response to this would be, oh, I'm really sorry that that's happening. That must be very frustrating. I'll look into it for you. You're not confirming the suspicion, you're not refuting it, validating that emotion and giving them reassurance as well. So you don't want to say you don't want to argue with the person and tell them that they wrote the signature, you must be crazy, those kinds of things. So the third one here, your loved one talked to their good friend on the phone yesterday, and when you see them today, they say my friend hasn't called in a long time, I hope they're okay. What would be an appropriate response? Something like, oh, I'm sure you do miss them. Maybe we can call them today. Something like that. What you really don't want to do in this scenario is bringing attention to the memory loss. Like, oh, you just talked to them yesterday. And then the last one here, you bring a family friend with you to visit your loved one. When you arrive, your loved one asks who you've brought with you today. So what would be an appropriate response here? A good response would be, oh, this is my friend Jim, or whatever the person's name is. And just introducing them like they're a new person. Not bringing attention to the fact that they've known this person and met this person multiple times. So those are some good scenarios. And that is all the content I have today. Here is a slide with the references for the information that I used in this presentation. So I hope you found this presentation helpful. Hope you learned something from it. And thank you for listening.